If you're pregnant, you might wonder what the placenta does and what factors can affect it. Get the facts about this important organ that joins the mother and baby. What does the placenta do? We continue and will always discuss this. The placenta is an organ that develops in the uterus during pregnancy. This structure provides oxygen and nutrients to a growing baby. It also removes waste products from the baby's blood. What affects the health of the placenta? Various factors can affect the health of the placenta during pregnancy. For example, 1. Maternal age. Some problems with the placenta are more common in older people, especially after age 40. 2. A break in your water before labor. During pregnancy, the baby is surrounded and cushioned by a fluid-filled membrane called the amniotic sac. If the sac leaks or breaks before labor begins, also called water breaking, the risk of certain problems with the placenta increases. 3. High blood pressure. High blood pressure can affect the placenta. 4. Twin or other multiple pregnancy. Being pregnant with more than one baby might increase the risk of certain problems with the placenta. 5. Blood clotting disorders. Any condition that either impairs the blood's ability to clot or increases its likelihood of clotting increases the risk of certain placental problems. 6. Previous uterine surgery. Previous surgery on the uterus, such as a C-section or surgery to remove fibroids, increases the risk of certain problems with the placenta. 7. Previous placental problems. The risk of having problems with the placenta might be higher if placental problems occurred during a previous pregnancy. 8. Substance use. Certain placental problems are more common in women who smoke or use cocaine during pregnancy. 9. Abdominal trauma. Trauma to your abdomen such as from a fall, auto accident or other type of blow increases the risk of the placenta prematurely separating from the uterus. Anyone who has been following our studies faithfully will understand the certain placenta problems we are talking about. These include issues such as placenta previa, premature separation of the placenta, which is termed placenta abruptio, placenta accreta, and retained placenta. The placenta attaches to the wall of the uterus, and the baby's umbilical cord arises from it. The organ is usually attached to the top, side, front or back of the uterus. In rare cases, the placenta might attach in the lower area of the uterus. When this happens, it's called a low-lying placenta, placenta previa. What is fundal placenta? A fundal placenta, also called the fundic placenta, indicates that the placenta is formed in the top region of the uterus, in between the two fallopian tube openings, also known as the fundus. The fundal placenta position is common, and the risk is low, because the position alone will not pose any complications. As with any placental location, monitoring a fundal placenta's condition is essential to ensure that it provides your baby with the support they need. This will be done during a regular pregnancy ultrasound. A few people may experience a combination of fundal anterior or fundal posterior positions. Placental positioning is usually monitored between 18 and 21 weeks of pregnancy with the help of an ultrasound. A fundic placenta can be classified as either a anterior fundal placenta, a placenta formed at the top and continues down to the front of the uterus, near the belly, is called the anterior fundal placenta, b posterior fundal placenta. A placenta that is formed at the top and continues down to the back of the uterus, near the spine, is called the posterior fundal placenta. Is it then normal to have a fundal placenta? Yes, it is normal to have a fundal placenta, because having a fundal placenta seems to be pretty straightforward. It is one of the most familiar placental locations. The placenta usually, while growing, can sufficiently nourish the growing fetus throughout the pregnancy. And as the pregnancy progresses, the placenta may tend to move toward the upper region of the uterus. Unless accompanied by any other signs or symptoms, it is rarely a cause for concern. Having either anterior and posterior fundal placenta is normal, and it will not affect the growth and development of the growing fetus in the womb. It is better to have a posterior placenta than an anterior placenta, because having the placenta on the back wall of the uterus, the mother can feel the baby's movements and kicks early and stronger. Fundal placentas, interesting. That was nice. We are continuing. Subscribe for more.